It is a flexible tube, and the biggest thing is you're asleep, so you're not going to remember anything. We give you some anesthesia, so you go to sleep, and we get a flexible tube that we have connected to a TV screen, and then we scope your entire colon, going all the way from the rectum all the way over to the right side where the small intestine connects to the large intestine.
The most common reason we do them is for screening purposes. Colorectal cancer is, I think, the third most common cancer in the United States, and it's one that can be preventable with routine screenings. So when we do these, we're looking for polyps, which are gross, could turn into cancer if we left them there long enough. So our goal with this is to find these polyps, remove them, and then they don't get a chance to turn into cancer.
This is the one thing that we can do to prevent cancer. We can get early identification. Most insurances will cover this procedure because it's a preventative measure.
We want people getting colonoscopies when they're not having any symptoms. That's really the best way to prevent it. Unfortunately, with colon cancer, when it starts causing symptoms, it's usually much more advanced.
I think everybody in the back of their mind worries they have something going on. So the fact that they can have a fairly painless way to do it, it's the best way that I know how to safely evaluate the colon, to be able to look at the most things. You can get a CAT scan, you can get other things, but they're not just as you're not getting a direct visualization. Plus, you can do biopsies. You can take things out while you're there. So I feel just the fact that you drift off to sleep, you wake up, you're not really any pain unless you're having some bloating or a lot of retained gas afterwards. But just knowing the fact that you did a good job on the prep, knowing that your colon's cleaned out, and that your health is going to be good for 5 to 10 years, depending on when your next time frame needs to be for your next scope. Number one, they've lowered the age from 50 down to 45. So anybody 45 years old really should get a screening colonoscopy. Now, a caveat with that is if you have a family history of colon cancer, you're going to want to get screened 10 years before the youngest person was diagnosed. So if your dad was diagnosed at 60, your brother was diagnosed at 50, you'd want to get screened at 40.
We are seeing colon cancer in younger and younger people. And so while you might be younger than 45, if you're having changes in bowel habits, chronic diarrhea, rectal bleeding, those are reasons to talk to your doctor.
So there's a lot of different ways you can prep the colon. So basically what this means is you have to drink some sort of liquid. Sometimes you take pills, and it just completely flushes your colon. So there's a newer one that came on the market that I started using. It's called ClinPick. There's a lot less volume to drink, and then a lot of people complain about the nausea, the bloating, the cramping. Sometimes people just can't drink a lot of volume. I mean, it's better than it was 30 years ago, but with this, you start, small bottle. There's 2 bottles in the kit. They're both less than a can of pop each, so very small. You drink it, it doesn't really taste that bad. It starts working within an hour, and then you do the other one 3 to 4 hours later. And then depending on what time you start in the day, if you choose to start really, really late in the day, then you might be up doing this for a while during the night. But if you do it earlier in the day, then it works really well.
I mean, this is the hospital's standard prep, which is just polyethylene glycol or Miralax, and then some other laxatives. With this one, you mix it with 64 ounces of water or Gatorade, whichever one you want. And there's instructions on here to drink a cup every 15 minutes for a couple hours and take these pills. And again, there's other options available if people want to take them, but they might be more. This one's free. The other ones might cost you some money.
In order to help you feel more safe and comfortable here, I feel it's important so they get to know the nurses that are taking care of them. I know about you, I know about the medications you're on. I try and reiterate what we're here for. Our most famous thing to help people feel better are our warm, toasty blankets when they get back here. Oftentimes I hear patients say on the way out how this was much easier than they ever thought it was going to be, and they appreciate our staff for helping them through a very unpleasant time. They're very glad they did it and share that information with friends and family. I have a lot of family that comes back. I have couples that do this at the same time, believe it or not. Even though it is a routine procedure, it's your procedure. We want to make that experience for you as positive and caring and easy as possible.